Do your clients have scars? Chances are that many of them do, because statistics tell us that there are 2.7 million new scars created each year in Australia, and a staggering 40 million scars in the USA are created each year. Did you know that scars can contribute and even be the cause of common pain conditions like low back pain or headaches? Many of my clients and even therapists themselves are just not aware of how scars can cause pain, restriction, and even pain and restriction distant to the site of injury. And unfortunately, many massage therapists, manual therapists, and other types of body workers have been taught to stay away from scars, or worse yet, to use heavy treatment techniques like cross-fiber friction, which are painful for clients to receive. And honestly, who wants to do that to a client who's been through enough already? Add to that, the latest research shows that these rough techniques often cause more harm than good by encouraging more scar tissue to form, which sadly creates more of the problem that you're trying to solve. The truth about scars was revealed back in 2010 when researchers published a paper reporting that 95% of all surgeries result in problematic adhesions, regardless of procedure or location in the body. Adhesions that directly or indirectly cause complications, including severe chronic pain, organ dysfunction, and increased need for redo surgeries, which include surgeries to release the adhesions themselves. This means that many of your clients may have a scar that is potentially creating pain, discomfort, or dysfunction. And the scar could be the root cause of the problem that your client is seeking help with, and is just not being treated effectively. Don't worry, I've been there too. I have also not known about the impact scars can have and how best to treat them. And like me, you need a better solution, one that allows you to treat clients with scars who really have been through enough already in a gentle, effective, and safe way. In my own practice as a remedial massage therapist, I began using a new set of techniques that got reliable results in an incredibly gentle way. I began using a new set of techniques that got reliable results in an incredibly gentle way with all different types of scars. But I'll go more into that in a minute, because my first experience with scar therapy was as a patient myself. Many years ago, I was at a workshop with other massage therapists learning some new techniques, but I had such bad pain from period cramps that I was having trouble concentrating. I was really struggling, and one of my colleagues got me on the table in the break, and even though she was working through my clothing, she leaned over within seconds of starting the treatment and whispered, "Christine, when did you have your surgery?" Now, I hadn't told her that I had had any surgery, but she could tell that I had had surgery simply by the way my body was behaving. She went on to do a very short, incredibly gentle treatment on me. And I maybe was on the table for about 10 minutes and got up from the table, and I could immediately feel a change, a difference in my body. The pain was starting to subside, and then a couple of hours it completely resolved. Now, this was pain that had not resolved with painkillers or meditation or breathing or stretching. And it was a common feature of my menstrual cycle. And after this treatment, I was astounded by how quickly she had made a difference to me. But the incredible thing was, I didn't have that same debilitating cramps for probably up to 2 years later. So it was very transformative, the change. So you can imagine how I wanted to know more about this. I had to know more. So I studied every single thing I could get my hands on about scars, learned about scar tissue, adhesions, fascia, nerves, lymphatics, and the latest research on how the body heals. Basically, I became obsessed with this topic of scars and adhesions for several years, and I used what I had learned on my clients with the old techniques and the new techniques on their scars, and I found out which techniques are the best. I found out that most of the old school techniques that I was taught in my training were effective, yes, but out of date. The gentle techniques seemed to work in a way that aligned with me much better, which is why after these experiences, I developed a pioneering technique, which I simply call gentle scar therapy, because it solves all these problems in a gentle way. When you use gentle scar therapy, you're able to apply a very light pressure with the techniques so that the client feels comfortable and safe. And you'll find that your clients get amazing results, like some of the ones you see on the screen right now, extremely quickly. It's astounding how effective these techniques are. And I know the system I use to teach this modality works because I first began teaching it to my staff and a few other local clinics in my area, and everyone was able to get the same reliable results as I was almost immediately. And now I've taught gentle scar therapy online to therapists from all over the world, and they have applied it to all types of clients, from young moms to CrossFit athletes, to those with cosmetic surgeries, to people with injuries, with hip and knee replacements. In fact, anyone with planned or unplanned scars. And the most common response is that clients are amazed at the changes they experience. They report feeling less pain or tension, having easier movement, restored sensation, softening of the scar, and reduced redness or visibility. But the feedback I love the most is when a client says that they feel like themselves again. And all of this is done from a whole person approach with specialized techniques that use gentle pressure, no greater than how you would touch your eyelid with your finger, just like this. So you see, gentle scar therapy program I've developed is unique. It gives you everything you need to treat people with scars with confidence safely. The lessons are incredibly clear and made with videos that are easy to follow and short. And they're made so that you feel like you're in the clinic room with me. You see everything that I'm doing. It's super practical and an amazing way to learn a new skill that makes you feel familiar before you've even done it yourself. I also teach everything in this one course that you're going to need to be a fully equipped and safe scar therapist. There's no secret masterclass. There's no other levels to come after this one. This course has everything you need. However, this means it is an in-depth course, and I cover a lot of ground so that you can truly specialize in this technique. So I only train a small group of therapists in each intake. I only do 2 or 3 intakes each year, and I've created it so that it's delivered in the best way possible for effective and engaging learning. So over the 8 weeks, you'll be able to access the online recordings, which you get forever. You can refer back to them whenever you need to. Plus, we'll connect each week over Zoom. And there's also a private group where you can get feedback and support as well, which means You'll walk away with a better understanding of the theory behind scars and fascia, and scars and nerves, and scars and lymphatics, and how the body heals. Plus, of course, all the techniques that you will use to work with all types of planned and unplanned scars, including atrophic, hypertrophic, keloid, burns, grafts, contusions, piercings, and contractures. And not only do you learn all the gentle techniques, but I'll also show you how you can perform a consultation, do an assessment, do the treatment, plan it out, integrate the scar, and re-educate compensation patterns. Then we'll look at how you can offer this technique in your practice. Like, what should you charge? And how can you do marketing that will attract people to this new niche service? Because there are some incredible opportunities out there for you as a therapist in this area, not just for your client outcomes, but also for you. Pre and post-operative care and scar therapy is a booming industry. And by developing this as a specialization, it will enable you to attract more clients and have a huge growth potential if that's what you want. Plus, this is such a gentle technique that it doesn't have to be the same physical toll on your body as delivering massage. So it's ideal if you want to reduce wear and tear, add a skill that you can use, and create a long-term career. Honestly, I just love gentle scar therapy, and I love being able to help therapists just like you to get better results for your clients in a way that feels good for them and you. So now I'd love to see you join the program. As I said, I only do 2 or 3 intakes a year, and each group is small so that I can connect really well and support everyone closely, which means if you have clients with scars and you can see how gentle scar therapy could help them, then please apply now so that you can get all the details of the upcoming course, dates, and fees. Because we speak with every applicant to work out if we are a good fit for you and if you are a good fit for us. This is not a buy-off-the-shelf, one-size-fits-all learning experience. This is an incredible technique with powerful outcomes for your clients and huge benefits for you as well. So apply now, and I look forward to connecting with you.